Good morning, Hugh.
Good morning.
How are you?
Good.
Good.
Good morning, everyone.
Good morning.
Good morning.
Good morning.
Morning, Dale.
Good morning, Dale.
Happy Monday.
Same to you.
Dale and Sharon, I'm going to be filling in for Trevor and in the Purnell slot today.
Okay, thank you, Jim.
Okay.
And I did get the medical examiner's responses today.
Okay, thank you.
Did you get those, Dale?
I don't think I've seen them.
All right. Hugh Shannon, let me see if I can pull them up.
Hold on.
Did you get them? Okay.
Let me go there.
Hugh sent them out this morning. I think Trevor forwarded them on to me.
I do not have the medical examiner's responses. I have the general set of responses.
All right, I will, let me forward those to you right now.
Okay, I take that back. I do have it.
Oh, all right, well, you now have 2 copies.
Okay, fine.
Oh, I see, yeah, you were listed on there, Dale, so, okay, yeah, all right.
Good morning.
Good morning, Mike.
Morning, Mike.
We still waiting on some people?
We're waiting on a few people, yes.
Okay, good.
I've never made it to county, so.
Melanie, are you filling in for Nicole?
Yes,
Okay, thank you.
thank you.
Hello, this is Nan Baker. Sorry for being a few minutes late.
Good morning, Nan.
Good morning.
We haven't started yet. You haven't missed a trick.
Oh, good. Thank you.
Okay, do we have Lee Tucker?
Let me take a quick look.
Thank you.
She should be on very soon, if not already. I think we got her. I think she's on. Yep.
Okay. Whenever you're ready, Mike.
Okay. Good morning, everybody. It's Monday, April 26th, Board of Control. Will the clerk please call the roll?
Good morning. Calling the roll for the Monday, April 26th Board of Control meeting. It is 11:02. Dale Miller,
Here,
Nan Baker,
Here,
Jim Boyle serving as an alternate for Purnell Jones,
Here,
Mike Chambers serving as an alternate for Erman Budish,
Here.
Lee Tucker serving as an alternate for the fiscal officer,
I know she's here. Are you on mute?
Okay. Okay, I'll come back. Melanie Say serving as an alternate for Mike Dever.
Here.
Lenora Lockett. Here. Lee Tucker serving as an alternate for the fiscal officer. Okay,
Might be having technical difficulties.
okay. Would you like to continue?
Yeah, we can continue. Hold on one second.
Audio problem.
Yeah, it shows that you're muted.
I tried to unmute it, it won't unmute.
It shows you in twice though.
Huh.
It shows that you're on here twice.
Okay, let me close one of them.
Okay, so we'll continue while Lee continues. She's got some technical difficulties. Sorry about that. I'm going to make a motion now for the review of the minutes for April 19th. Do I have a second to approve these minutes?
Second.
I'll second.
Oh, go ahead, Dale. There.
Seconded by Councilman Miller. All those in favor say aye.
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 Opposed? Okay, the minutes are approved. Lee, are you on now? Can you? No, she's having technical problems, but she's there. At this time, then, we will ask for public comment. If there's anyone from the public, feel free to speak at this time. Okay, there is no public comment. Moving on to contracts and award.
Okay, first item, BC 2021-186, Office of Innovation and Performance, submitting an RFP exemption on requisition 5896, which will result in an award recommendation to PCs for People Ohio LLC in the amount not to exceed $150,000 for low-cost in-home internet access services and related equipment for residents in the city of East Cleveland for the period May 1st, 2021 through April 30th, 2022, and recommending the award in connection with said RFP exemption.
Hi, Catherine Tkachuk, Chief Innovation and Performance Officer, to talk about this item. This is an exciting project where we are trying to address the digital divide in East Cleveland. The county would be providing $150,000 to PCs for People, matching dollars that have been provided by Microsoft and Eaton, as well as in-kind investments by the state, university hospitals, and many others, to provide a low-cost in-home internet access plan ongoing for the city of East Cleveland. This would be a one-time investment in the infrastructure and possibly some of the digital literacy and community outreach, as well as modems for up to 1,000 people to get on this plan. That would be a $15 a month ongoing service. It is a pilot project to test a technology using the CBRS spectrum. I can do my best to try and explain that if anyone has questions on it, but don't want to get myself into too many technical discussions. But this is a newer technology that's been deployed in some other locations, including one by PCs for People in rural Ohio. And so this would be a test of it in East Cleveland to see if it would work in a more urban setting, and has the potential to be very good at helping us to address a digital divide, not just in East Cleveland, but in other locations around the county. So that's where we are testing it, and happy to answer any questions you have.
Thank you, Catherine. Are there any questions from the board on this item?
Yes. My first question is whether anybody in East Cleveland would be eligible to obtain this $15 a month internet service, or would it be limited to people who meet some kind of test for low income?
No, so it would be eligible to anybody. However, we are going to prioritize with the 1,000 people or the first 1,000 subsidized modems. They are prioritizing residents who have a student in the East Cleveland schools. So that's where their priority is going to be, but it would be open to everybody. It does not require a low income threshold.
And am I correct that the $15 a month that's paid is enough to sustain the operation, and that the funds are needed only for the infrastructure setup and communication, but not for the ongoing operation?
That is correct. And yeah, that's why we want to try this, because we believe it'll be a sustainable solution that wouldn't continue to require investment from the county to continue at a low cost.
And final question, if the pilot is successful, how much capability is there for expansion of this program? Could it be made available to every East Cleveland resident who wants it? Does it have that much capability?
So if the pilot is successful, it would require some additional infrastructure dollars. They have to place more antennas and equipment in order to expand beyond the original capacity. But the intention would be, I believe, to look to raise additional dollars if this pilot is successful to continue to expand the option.
Okay, thank you.
Are there other questions from our team?
Yes, Man Baker.
Yes.
So, looks like a great program, Catherine, so thank you for putting this together. The question on the $15 a month, is that a commitment that will be met for future years? I mean, prices go up, program's over, they didn't continue it, so what they had is what they had. How do you see this? How many years can you go on without having more support for upgrades and expansions and things?
Right. So I can't guarantee that $15 a month will continue forever. I recognize that that's probably not going to happen. I will say, PCs for People has been providing a sort of $15 a month plan. As a nonprofit, this is part of their goal, is to create these low-cost internet plans for people. So what they have been providing that for quite a few years now, and the intention is always to maintain an affordable plan. Again, this speed, it's a 50/10 speed, so it's not super fast internet, and that can help keep some of the costs down. It's certainly good internet that will allow people to do the things they need for work, school, all of that, but it's not, what you're seeing in homes now where people are getting a gig service. But our intention is to always try and maintain a low cost solution. And we believe with PCs for People, that is part of their mission. So that will still always be a part of what we're trying to do.
All right, and the over understanding East Cleveland and knowing that there's about 8,000 households, and in family households, which it doesn't sound like we're targeting families. This is open to anyone, work, school, elderly. How do you choose when you only have 1,000? First come, first serve, but it just seems it's 1/8 perhaps of the households of how this pilot program's going to begin. I would think if it's going to be successful, it would have to be expanded.
Yes, again, I think what they're doing is they are targeting families with students first. That is the group they're going to be reaching out, working with the East Cleveland schools to make sure those with a student are getting signed up and kind of reaching out to them directly. We have found that while these programs are out there, we do need to do community outreach to get people signed up. There's a lot of mistrust that $15 is really $15. If you've ever signed up for a cable bill or something like that, you can understand some of that mistrust. So I think this is, again, a good first step. This is not the end of everything we need to do about the digital inclusion. It's just a first step. And I think it's a really good example of us working with not just public dollars, but also private sector and the state to try and start a program. And then we'll have to continue and see how we can continue to expand it if this is successful.
Well, good luck with the program.
Thank you.
Looks like a good one. Appreciate it.
Mike, real quick.
Yes, go ahead, Jim.
So Catherine, you touched on it with the outreach. Is that going to be run by PCs for People, or who's going to run and kind of direct the outreach? Because I obviously, as Councilwoman Baker mentioned, I mean, it's a great project, and I think I am a little concerned about the outreach.
Right. So we, as part of this project, we know outreach is really a big, important part. So that's why the school district has been engaged to reach out specifically to their families,
Okay.
As well as the Urban League has been included in many of the discussions as part of this to continue that outreach. So we know that's an important part. It's not necessarily, if you build it, people will just sign up. We need to do that community outreach. And that's why for the county, we've allowed some of our dollars could be used for that outreach if needed. But we're also partnering with some of those local partners that have that trust in the community as well.
All right. Thank you.
A follow-up.
Yes, please.
Dan, how does this interact with, I believe, I'm going from memory, Community One, where we had internet access to those that had difficulty? How does all that come together? Is this part of that, or is this separate from that?
Yeah, so I think you're referring to Digital C is another nonprofit that provides some excellent work in some of the Cleveland neighborhoods. You remember a few years ago, we did a lease with them for the Juvenile Justice Center to provide internet access in the Fairfax neighborhood. That was supported by you, Councilwoman, as well as others. And this is an addition. This is the same type of kind of thing that's being done. And again, I think it's a matter of there's a lot of need in the community. So having more than one group working on this is helpful in us in creating that different options for people and in different places so that we make sure we have the capacity to continue to expand beyond just initial neighborhoods.
So some of these in East Cleveland could already have what they need, and this will just be narrowing down those that have not yet been able to receive it?
Yes, so some people, there is East Cleveland, about half of East Cleveland already has internet service. They're paying for it through whatever option they're choosing to. So this is really focusing on those who don't have internet service in the home, or maybe where the cost burden is very high for them, that they're paying it, but they're struggling with that. So that's where this focus is.
Interesting. Okay, well, thank you. Appreciate it.
Hey, any final questions on this item from the board? Sharon, I recognize Lee Tucker's here now.
Yes, I was going to call the roll for Lee.
Okay, do you want to? Go ahead.
Yes, for the record, calling the roll for Lee Tucker.
Present.
Thank you.
Okay, at this time, I'm going to make a motion to approve this item. Do I have a second?
I'll second, Nan Baker.
Seconded by Councilman Baker. All those in favor say aye.
Aye.
Opposed? Item approved. Next item, please.
Next item, BC 2021-187, Department of Information Technology, on behalf of the Department of Public Works, submitting an RFP exemption on requisition RQ 6084, which will result in an award recommendation to TEC Communications Incorporated in the amount not to exceed $16,469.22 for a state contract purchase of Cisco gear switches and access points for the Justice Center Complex, Tower 2, and recommending the award in connection with said RFP exemption.
Good morning, Janelle Green on behalf of the Department of IT. This is a purchase of our standard Cisco switches and access points to allow for internet services in the Justice Center Complex, Tower 2, as there is a build out on the 6th floor for the sheriff over at that building.
Okay, thank you, Janelle. Are there any questions from the board on this item? Hearing none, then I will make a motion to approve. Do I have a second?
Second.
Seconded by Councilman Miller. All those in favor say aye.
Aye.
Opposed? Item approved. Next item.
Thank you.
Next item, BC 2021-188, Department of Workforce Development, submitting an amendment to a contract with Towards Employment for the Out-of-School Youth Program for the Comprehensive Case Management Employment Program, Employment, Education, and Training Services for Young Adults in connection with the Workforce Innovation and Opportunity Act for the period July 1st, 2019 through June 30th, 2021, for additional funds in the amount not to exceed $386,867.
Good morning, Frank Brickner from Workforce Development. This is a shared contract with Job and Family Services to provide needed workforce services for young adults between the ages of 18 to 24 who are out of school. Why additional funds are necessary? Because when we first amended the contract, we didn't know how the pandemic would go. So we put funding in place through December. We've had negotiations since that with the provider. How many people they're serving, and this is the amount deemed necessary to get them through June 30th. I did want to point out one thing with this contract. As part of the 386,000, 90,000 of this is tied to career training, and it's a specific linkage with manufacturing access, which is part of the sector initiatives. And it's a design program by manufacturing employers to get individuals into manufacturing careers into the world of work. So we're really happy to partner on that.
Thank you, Frank. Are there any questions from the board on this item?
I have just one question, just for clarity. During the pandemic, and I'm saying we're hopefully on the extreme backside of this, there was not a lot going on. So I'm trying to read your explanation here. Was there a delay in what was given in the types of services that we would typically give in a regular year?
What we did is last May, June, we amended the contract, but only provided half of the ask from these agencies.
Okay.
Because we didn't want to commit. We didn't know how it would go. So that's why we had to go back and then add money to it when we were pleased, at least, with their efforts to engage.
Wow, who does that?
Officials.
Okay. Way to disconnect that.
I don't know. Is it the one with 605?
Yeah.
Whoever was putting us on hold, please do not do that again, or you're going to
I just muted him.
Okay, thank you. Go ahead, Frank. I apologize.
I think I was finished. I just was saying that we had amended all our contracts. Our funding year is July to June, and we had initially a workforce only given 6 months of funding to all our providers initially, just to see how we were going to merge. How were they engaging individuals? Were they recruiting them? So this is, I think, the last one we're amending on the young adult side.
And you, if I may, you did find that they were able to connect and that the process did continue, even though we were pretty much.
There were reductions. We're going to have, fortunately, WEO allows a lot of carry in. We're going to be carrying in a lot of funds. I'll be honest, we're serving less people. There's less work experience going on because there's less job sites for young adults to go into. So fortunately, this gets us through, though. It allows career training, which we really wanted to emphasize. You can do career training from your own home and that in a lot of the fields. So that was really our emphasis this year. So I'm very hopeful that numbers getting into work experience and job placements will grow next year as we emerge.
All right, well, good. Thank you for the explanation.
Welcome.
Are there any final questions from the board on this item? Hearing none, then I'll make a motion to approve. Do I have a second?
Second, Miller.
Seconded by Councilman Miller. All those in favor say aye.
Aye.
Opposed? Item approved. Next item, please.
Next item, BC 2021-189, Department of Workforce Development, submitting an amendment to a contract with the St. Vincent Charity Medical Center for disaster relief employment services in connection with the Ohio Means Jobs Cleveland, Cuyahoga County National Health Emergency Disaster Recovery National Dislocated Worker Grant Program for the period December 9th, 2019 through December 31st, 2020, to extend the time period to June 30th, 2021, and for additional funds in the amount not to exceed $33,150.
Frank Brickner, Workforce Development. This is a federal grant that we were given to assist individuals with opioid epidemic, to really address the opioid epidemic, to either assist individuals or employers addressing it. One of it was to allow for subsidized payment for certain careers for organizations combating the opioid epidemic. St. Vincent's hired an intake coordinator to work weekends and after hours as individuals came in battling opioid to do counseling and get them to what they really, where they need to get. Here's initially our grant only allowed for 51 subsidized weeks. After that, because of the pandemic, the Department of Labor allowed an extension and said you can extend it, which is why we're able to extend it through June 30th. The grant was extended and this program specifically was extended. However, we couldn't amend the contracts immediately because we have additional funding. And the state was able to identify additional funding to allow these extensions. And we didn't get that word till January. As soon as we got the word, we worked to amend the contracts we had in place, and this is one of them. And there were some delays from St. Vincent's Legal approving the amendment.
Okay, thank you again, Frank. Are there any questions from the board on this item? Okay, hearing none, then I will make a motion to approve. Do I have a second?
Second, Boyle.
Seconded by Mr. Boyle. All those in favor say aye.
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 Opposed? Item approved. Next item.
Next item, BC 2021-190, Department of Workforce Development submitting an amendment to a contract with the Edna House for Women Incorporated for disaster relief employment services in connection with the Ohio Means Jobs Cleveland, Cuyahoga County National Health Emergency Disaster Recovery National Dislocated Worker Grant Program for the period October 21st, 2019 through October 21st, 2020 to extend the time period to June 30th, 2021 and for additional funds in the amount not to exceed $33,156.48.
Frank Brickner again from Workforce Development. Edna House hired a peer person, intake person. Because of the opioid epidemic, they were swamped with individuals. And just like the previous discussion, we had to wait for our approvals from the feds and the state regarding additional money and the ability to extend contracts to June 30th.
Thanks again, Frank. Are there any questions from the board on this item?
One comment, and I know that it's this and a few others. I understand the delay, and it's good that we were able to get additional funds, but why 6 months? Why does it take?
It was very frustrating on this one. We, like I said, we got our word into the state. We were asking way before October about extensions, and it wasn't until November we got the extension. It was like, well, great, but we need additional money. And that didn't come till January. And then this was a contract that ended last year. So in our in-force system, we had to convert it. That took weeks. Then we found out that they weren't on the IG registered list. We had to get them, so there were all kind of delays, and I hope it doesn't happen again.
Do you think, if I may, do you think you've overcome the obstacles that you were presented with, and that if this were to happen again, you would be able to get this through the process easier than what you have?
Yeah, I think we're becoming more familiar with Enforce, so we'll become more efficient with it. But I can't answer in instances where we're waiting for the federal government or someone to say yes after the fact and then expecting us to extend.
Right, I understand that. But from the point that you have it, I believe you said October or November of last year, and this is going into May.
Right. I think we know what to look for now and how to follow, and maybe who to ask for assistance from to help move it along the way.
Okay, thank you, appreciate it.
You're welcome.
Any other questions from the board on this item? Okay, hearing none, then I'm going to make a motion to approve. Do I have a second?
Second, Miller.
Seconded by Councilman Miller. All those in favor say aye.
Aye.
Aye. Thank you.
Opposed? Item approved. Next item.
Next item, BC 2021-191, Court of Common Pleas Juvenile Court Division submitting an amendment to a contract with Court Smart Digital Systems Incorporated for audio and visual recording system maintenance and support services for the period January 1st, 2013 through December 31st, 2020, to extend the time period to December 31st, 2021, and for additional funds in the amount not to exceed $105,452.64.
Good morning, this is Sarah Baker from Juvenile Court. This is an amendment with Court Smart Digital Systems, and they provide our audio and visual recording system in all of our courtrooms. So this is just for the maintenance and support going forward for 2021.
Okay, thank you, Sarah. Are there any questions from the board on this item?
Yes, I have a couple of questions, and the first one is whether the price is the same as what it's been or whether the cost has gone up.
It has gone up slightly, but we've pretty much been around the 100, 104 range for the last couple of years.
And why is it that we only extend this a year at a time instead of a longer extension?
Usually that's due to kind of how the vendor has asked for it. In case their prices do go up, they don't really want to lock it in for longer than a 1-year term.
And are these folks the only people that could provide these services, or is there a point at which we would put out an RFP and see what else is out there? And if so, when would that be?
So I believe back in maybe 2010, we brought Court Smart in based upon doing a bid, and they provide all of the equipment, the microphones, the software, all that stuff that's in each one of our courtrooms. So now what we use them for is just maintenance and support. We have kind of talked about maybe completing some sort of a competitive bid process, but whatever we would end up going with would be more expensive upfront. So we've kind of just been keeping up with the maintenance and support because we've not had any issues with them. If we need any different types of microphones or additional microphones or other kinds of software or updates, they're the only ones that can provide it to what we currently have.
Understood. Thank you.
One question, Chair, if I may.
Sure.
So given that this ended at December 2020, and it's coming out of the general fund, and it's been in place since 2013, so this isn't something new that we were wondering if we were going to do and took time to, this is just an extension of something we've already had. It's hard to understand why this would be so late. And I understand there's a learning curve and all, but we've been hearing that quite a bit. How can we get these contracts that we know are coming up for renewal to us in enough time that we don't have to be extending a contract that already ended?
So I would say that with this contract specifically, that the lateness was more so due to the learning curve of the system. We did put this in to start converting it last year, and between December and April of 2021, it's gone back and forth between us making whatever changes, or it's going to various queues, or we've had to redo it. So I think part of the reason why a lot of our contracts, especially coming up or on the later side, is due to that learning curve and the implementation of the new system. However, we have sought training and we know the people to reach out to. So I will say in the last couple of weeks that we've seen a lot more of our items go through a little bit smoother. So I'm hoping that we're kind of on the upswing of that.
Sarah, is there anything to prevent us from starting these contracts knowing that it's a long-term contract that is now ending? We could start maybe 4 or 5 months before, knowing where's a learning curve and we have the challenge of making sure it's presented to Board of Control on time. Can we be more proactive in that, or is that just not something we can do to start earlier?
Right now, we typically start about 3 to 4 months earlier. And that was kind of pre-contract module and Infor. So I think now that we've seen that it does take things a little bit longer, we are starting things earlier going forward.
Okay. Well, hopefully when this is all done, this is supposed to be a more efficient process. And then you will not need that much of a lead time. But until then, it does sound like there's a learning curve, and it would be good to have these contracts before us, at least at the time that they begin. Thank you.
Mike, can I ask a question real quick?
Yes.
So Sarah, I got your comments about Court Smart not wanting to engage in a longer contract than 1 year, but there's two sides of the contract. I mean, so we can certainly approach that with a longer term contract, which would then potentially alleviate some of the issues that Councilwoman Baker said about, the constant need to get the contract approved, but also, I mean, you may get an economy of scale situation where, locking in might be the right thing to do from the county perspective. I mean, have we or the lawyers looked at that?
I believe that they have, and I can definitely say that something we will look into for next year. Unfortunately, this year it did not occur.
Yeah, and we're already a quarter of the way done. I mean, I'm making the assumption that they've been doing work on this contract in January, February, March, and April, correct?
Correct.
All right, so we're already, we can't, for this year, obviously, we can't get out of it. I mean, they've already in it, but the moving forward, either, I think the move might be to look at a longer term contract with this vendor, or potentially putting out, a different procurement method to see what else is out there.
We can definitely do that.
Okay, Councilwoman Baker, I'd like to add on to your question a little bit earlier about the conversion. The conversion is just a one-time issue. As Sarah just noted, this goes back to 2010. So the intention was to get all those documents into the new system instead of having them piecemeal in the old and new system. So that's a one-time issue. And like Sarah indicated, the learning curve. So I would assume that once these conversions are going, these amendments going forward should go a lot quicker. But I just wanted to add that into the conversation. So
Thank you. I appreciate that. And, as Jim mentioned, if I may, this is, if I'm reading this correctly, this was is that an 8-year contract? And Court Smart, we're only extending from the same company that we've had for the last 8 years. Am I right about that?
Yes.
Yeah.
So why would they, after an 8-year contract, limit us to 1 more year?
We will definitely bring that to our attention going forward for the next term.
Okay, thank you.
any final questions from the board? Okay, hearing none, then I'm going to make a motion to approve this item. Do we have a second?
Second, Miller.
Seconded by Councilman Miller. All those in favor say aye.
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 Item approved. Next item.
Next item, BC 2021-192, Department of Public Safety and Justice Services, recommending an award on a purchase order to Rosenbauer South Dakota LLC in the amount not to exceed $277,316 for the purchase of 1 breathing air supply response truck for the Lake County Hazardous Materials Team.
Good morning, this is Mary Beth Vaughn from Public Safety, and this is a purchase of a special mission vehicle to provide self-contained breathing apparatus air to the special teams and hazmat personnel who are called to a protracted incident scene. Lake County is replacing a 30-year-old truck. This may sound familiar to you because while we did competitively bid this purchase, we did seek an alternate procurement back in March to waive the bid bond requirement so that we could move forward with the bids that we received. The recommendation is to award a bid to the lowest cost vendor, and the funder, Ohio EMA, has approved the award.
Thank you, Mary Beth. Are there any questions from the board on this item? Hearing none, I will make a motion to approve. Do I have a second?
Second.
Seconded by Mr. Boyle. All those in favor say aye. Aye.
Aye.
Aye.
Opposed? Item approved. Next item.
Thank you.
Next item, BC 2021-193, Medical Examiner's Office submitting an RFP exemption on requisition 5965, which will result in a payment to Thales Disc USA Incorporated, formerly known as Gemalto Cogent Incorporated, in the total amount not to exceed $239,788.18. to cover the remaining balance on one final invoice for hardware and software maintenance on the automated fingerprint identification system for services rendered from January 1st, 2020 through December 31st, 2020 in connection with contract number CE 1400358 and recommending the payment in connection with said RFP exemption.
Hugh Shannon from the Cuyahoga County Medical Examiner's Office. This is our final payment to this company for the work of installing the new automated fingerprint identification system. We received the final invoice on December 17th of last year, which left us with no way to pay. There were no meetings left for that year and no way to get the funds encumbered. So when we came to the 2021 year, we had to go through and get the funds actually got swept out of our budget at the end of 2020. So we had to identify funds for this last payment. And we also had a transition in our procurement team, and they're working out great, but it took them a little time to get up to speed. And then, of course, we had to wait until sales had gotten their Inspector General's paperwork back and get recertified for the 2021 year.
Thank you, Hugh. Are there any questions from the board on this item?
Not a question, more of a comment. I mean, Hugh, it sounds like everything that could possibly go wrong with this last payment seemed to have occurred.
Yes.
And the contract's over, so there's no work being done. We just owe the money, right?
Correct.
All right.
And if I may, for clarification,
Yes.
this isn't additional money. This is just money that, as you said, got swept out, and now you're just replacing it. There is no in addition to what we contracted.
Correct.
Right.
Any final questions on this item? Hearing none, I will make a motion to approve. Do I have a second?
I'll second. Randy.
Seconded by Councilwoman Baker. All those in favor say aye.
Aye.
Opposed? Item approved. Next item, please.
Next item, BC 2021-194, Medical Examiner's Office, submitting an RFP exemption on requisition 6203 in the amount not to exceed $3,990 and requisition 6204 in the amount not to exceed $2,156, which will result in a payment to Bob Barker Company Incorporated in the total amount not to exceed $6,146 for the purchase of 300 cases of latex nitrile gloves and recommending the payment in connection with said RFP exemption.
Hugh Shannon, Medical Examiner's Office again. So we are purchasing larger amounts of PPE. This is for our daily use. But with all of the supply issues that have kind of propped up over the last year across the country, we decided that getting this larger purchase to make sure that we have what we need on hand was a better way to go. And we have worked with EMA. I know there was a question about kind of the stockpile, and we are working with them to replace the stockpile that we had distributed last year. Some of that is useful for us in our daily operations, but there were some things that that EMA couldn't get that we still need on a daily basis. Latex gloves were not part of the purchase by EMA for the stockpile, and those are needed in autopsy and in other places in the building.
Thank you, Hugh. Are there any questions from the board on this item?
Yes, this is Dale, and if I may, I just had one additional question on the previous item, which was what was the total cost for the installation?
It was, get you an exact amount. It was under $1 million. I think it ended up being 930 in that neighborhood, 930,000.
Okay, thank you.
Yes, sir.
Are there any other questions on the current item? Hearing none, then I will make a motion to approve. Do I have a second?
Second.
Seconded by Councilman Miller. All those in favor say aye.
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 Opposed? Item approved. Next item, please.
Thank you.
Next item, BC 2021-195, Department of Health and Human Services, Division of Children and Family Services, submitting an RFP exemption on requisition 5937, which will result in an award recommendation to MNJ Technologies Direct Incorporated in the amount not to exceed $72,979 for a state contract purchase of 95 Microsoft Surface Go 2 tablets and related accessories for graduating foster children, and recommending the award in connection with said RFP exemption.
Morning, Dan Basta, Health and Human Services, on behalf of the Division of Children and Family Services. This is to purchase Microsoft Surface Go 2 tablets and related accessories for children that are graduating high school that are aging out of care. A little caveat to this, I did answer some questions prior to the meeting. Also, the initial payment will be done through the normal channels of 70% Health and Human Services levy and 30% Title IV funds, but it is fully reimbursed by the Chafee Act. I'd be happy to answer any questions.
Thank you, Dan. Are there any questions from the board on this item?
Yes. Can you say a little bit more about this JV Act that it's fully reimbursable to? What is that?
The federal government allots a certain amount of money for children that are aging out of custody. That's from the Chafee Act. Whatever they allot a certain amount of money for graduation proceedings, as well as rewards for those that are graduating. And it's a certain stipend amount for each child, as well as certain expenses for those that are going to college or pursuing further education.
Okay, that sounds good. Thank you.
Sure.
Other questions from the board on this item?
Just a question. Why under funding source aren't we noting that this will be reimbursed by the JV Act?
I think because initially we're going to be paying through the normal channel of payment, and we have to wait for the reimbursement from the federal government.
Well, we do that with the CARES Act, though, don't we? We pay and then we get reimbursed.
I'm not quite sure on that.
Okay, and your comment on the not going out to bid, and I understand that it was bid out by the contract pricing by the state, and it's only a 10% reduction. Are you absolutely sure that there isn't, if we went out to bid, given the number that you're purchasing, that you couldn't get a better price?
Well, Councilwoman, these products are Microsoft products as well as Hewlett-Packard products. And most of the time, from what I've gathered from doing multiple bids on these types of items, there isn't a lot of margin for profit for these items. They sell no matter what. So they don't really give bulk pricing or government pricing breaks.
Wow, and for 95, I mean, that's a considerable amount of purchasing. Okay, thank you.
Councilwoman, if I could add, I believe the Department of OPD also puts this on the website for another week to see if anyone else wants to bid.
Okay.
So that's another secondary measure as well.
All right, thank you for that.
Any final questions on this item? Hearing none, then I will make a motion to approve. Do I have a second?
Second. Boyle.
Seconded by Mr. Boyle. All those in favor say aye.
Aye.
Aye. Opposed? Item approved. Moving on to exemptions, please.
Yes, the next item is BC 2021-196, Department of Health and Human Services, Community Initiatives Division, Office of Homeless Services. recommending an alternative procurement process which will result in the solicitation of proposals from various U.S. Department of Housing and Urban Development approved providers in Cuyahoga County to provide permanent supportive housing services to chronically homeless single adults and high barrier homeless persons for the period July 1st, 2021 through June 30th, 2022, with Famicos Foundation, Front Steps, Humility of Mary Opportunity House, Frontline Service, Emerald Development and Economic Network Incorporated, CHN Housing Partners, and YWCA of Greater Cleveland.
Good morning, everyone. Melissa Sturak with the Office of Homeless Services, requesting approval of an alternative procurement process to award Health and Human Services funded contracts to the listed HUD-approved permanent supportive housing or PSH providers serving our Cuyahoga County. These providers operate 13 PSH sites that serve chronically homeless single adults and high barrier homeless persons as part of the Housing First initiative, which was established in 2004 with the goal of ending chronic homelessness in the county. These entities are deemed by HUD as the Housing First PSH providers. This funding was included as part of the biannual budget and is intended to supplement existing federal HUD funding in the programs for operating and supportive service budget. It's intended that all approved vendors for these services will receive funding as part of this process. Using the alternative procurement method, OHS will assure the continued availability of services to the chronically homeless single adults and homeless persons with high barriers to this housing.
Okay, thank you, Melissa. Are there any questions from the board on this item? Hearing none, then I will make a motion to approve. Do I have a second?
Second, Miller.
Seconded by Councilman Miller. All those in favor say aye.
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 Opposed? Item approved. Moving on to today's consent agenda.
It's moving on to consent agenda items number BC 2021-197 through 198.
Board members, if you take a moment to look at the consent agenda item, if you have any questions, feel free to ask. Are there any questions from the board on any of the items?
I have a question on the Griffith and Strong disparity study. So the contract amount was almost 300,000. And I know in the last meeting we had, I believe it was in the Health and Human Services, or no, HR committee, that the price that we were looking at was 500,000. So is this 300,000 part of that proposal to encompass the amount that was requested?
Nora Lockett, Office of Procurement and Diversity.
Yes.
The 500,000 that was mentioned by the fiscal officer, and it was related to funding diversity initiatives. That was not related to funding the disparity study.
Okay, so it's 500,000 plus the study of another 300,000.
Lenora Lockett again. The study was committed in 2019 when the vendor was awarded.
Yes.
There's approximately, I believe, up to, again, we haven't paid the final bills because we also did, they did a presentation to council. So there's still some final bills out there, but it has not, there might be about, again, a brief 9 or 10,000 or so remaining on that contract. That is not part of the 500,000. The next disparity study, which is supposed to be, again, based on county code within that 4 to 5 year period, we're going to start in 23. So at that time, either with the 2020, so we're doing the 22-23 budget. So probably within the next cycle, 2-year biennium, not the current one, but the one right after, will be coming, asking for money to pay for the next study.
Oh, I'm sorry, and all those are in silos.
Yes.
They're interrelated at all, as far as funding goes.
Correct. funding for the contract will be done as part of the budget process for the department at that time because it's not an every year payment, every year budget. It'll be for that procurement. The 500,000 is related to the initiatives that came out of the case and the equity commission. And those were the matters that the fiscal officer presented that we're looking at potentially. A lot of things were on the table, but because of the 500,000 is a significant amount, but the estimate for if the new department the disparity study recommended increasing staffing to make sure that we can do the compliance and the additional level and intensity of work needed to implement the recommendations. And the first part of that funding potentially would be from that 500,000 to gear up with those additional staff.
And if I may, looking ahead, the 2023 study, do you anticipate that it would be another almost 300,000, or is that more like an amendment that would be considerably less?
Lenore Lockett again, it would be a RFP or RFQ, and it would be for another study for another 5-year period. So I would anticipate it would be at least comparable to the 300,000, around 300,000 or more.
I see. All right, all good to know. Thank you.
Okay, you're welcome.
Any other questions on today's consent agenda items? Hearing none, then I will make a motion to approve. Do I have a second?
Second.
Seconded by Mr. Boyle. All those in favor say aye.
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 Opposed? Okay, today's consent agenda has been approved. Moving on to public comment. If there's anyone from the public that wishes to speak, you may do so now. Okay, there's no public comment. At this time, I'm going to make a motion to adjourn. Do I have a second?
Second.
Seconded by Councilman Miller. All in favor say aye.
Hi.
Aye.
Opposed? We're adjourned. Thank you again for your time and have a great week.
Thank you.
Take care.
Thank you.